Okay, welcome back everyone to Our Womanity. I'm so excited to have Lindsay Means here. As you know, menopause and perimenopause affects women from their head to their toes, and we have estrogen receptors throughout our entire body. So it totally makes sense that every field is actually affected by perimenopause and menopause, whether we've talked about it, acknowledged it, or not. And Lindsay is a nurse practitioner with the Ear, Nose, and Throat Institute at University Hospitals Cleveland Medical Center, and I'm so excited to have her on today. Welcome, Lindsay.
Hi, happy to be here.
Lindsay and I go way back. She used to be in a different field altogether, if I could say so. She used to be a nurse practitioner with GYN Oncology, and that's how we met each other. And we live in the same neighborhood, so we bumped into each other at the playground and started talking about some of the things that Lindsay sees in her office for women going through perimenopause and menopause. And I'm like, okay, we got to talk about this on the podcast because people need to be aware of this. So thanks so much for being here, Lindsay.
Absolutely.
And I'd love to just hear, some of that stuff that we were chatting about, the things that come up for people. So what do you see in your office?
The biggest thing that I see related to perimenopause, menopause is dizziness. So, as an ENT provider, my specialty is otology, neurotology. So, just ears.
Okay.
So, anything ear related, including balance. So, I am the front line for our team. Anybody referred for any type of balance issue usually comes through me first.
Cool.
Um, there's a few things that, expedite people in to see the surgeons, but primarily most of the dizzy patients that get referred do not actually have an inner ear disorder. One of the things that would be great to clarify for everyone
Yeah.
out there
Yeah.
is the difference like what is vertigo?
Right.
Vertigo just means spinning. Either I myself feel like I'm on a spinning ride or literally see the world spinning around me. That's
Mm.
vertigo. It just means spinning. It's not a disease, it's a symptom.
Okay.
Lots of people come in and say, "Oh, I went to the ER. They diagnosed me with vertigo." Like, did you feel spinning? No, I was really lightheaded. I'm like, then you don't have it.
Right.
So there's a big difference in the things that can cause vertigo versus other balance issues. So people
Excellent.
may experience lightheadedness, unsteady, off balance. One I get a lot is like bobble-headed, like my head is floating
Hmm.
above my body, disconnected from my body.
Ooh,
Yeah.
it's disconcerting.
Yeah. Yeah. Or, and then to full on spinning. So
Yeah.
the best thing to do is to get a good history. What do you feel
Okay.
when this is happening?
Yeah.
How long do you feel it nonstop? How often is this coming? That really tells me a lot. And I'm always amazed when I look at other people's notes. Like it's just, they complain they're dizzy. That's it. Go
Yeah.
see ENT. I get a lot of referrals for elderly patients that tell me I get
Mm.
lightheaded when I stand up. I'm like, well,
Wow.
that's
Okay.
not at all the
A little
same thing.
different. Yeah.
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 So, a big cause of dizziness, especially in women, is migraine. And
Mm. Okay.
so you can have a vestibular migraine, so it affects your balance centers,
Mm-hmm.
can make you feel absolutely horrible,
Mm-hmm.
but you may not have any headache at all.
Wow.
So there's lots of people that as soon as I say migraine, they stop listening because they're like, well, I don't have headaches, so it can't be that.
Hmm.
And I use this as the best example of this is how migraines can change.
Yeah.
So many women will describe terrible premenstrual migraine headaches.
Right.
I went through menopause and my headaches went away. So I don't have migraines anymore. Like, oh, now you have a different migraine.
Oh, interesting. What does that mean? What happens to them?
Chemically, I don't know what
No, no, I
happens.
mean, but
Yeah,
like they
but
just the symptoms are changing. Is that
yes,
that's so
yes.
interesting. And
So
and
so
probably
instead of
nobody knows chemically, right? Like we don't, we look at
right,
perimenopause and menopause and we're like, I don't know, the
yeah, it could
hormone
be anything happening.
estrogen
Yeah.
decreases and
Yeah, I
what's
just
going
tell them,
on.
those hormones are shifting and changing,
Yeah.
and that can trigger this.
Yeah.
So, generally speaking, so migraines can manifest in a lot of different ways. And
Okay.
I'm not a migraine expert, I'm the ear expert. So, really getting that good history, tell me what happens to you. So, I have a whole list of questions that I ask people.
Yeah.
But basically, people having migraine type tend to have very long lasting episodes. I'm
Okay.
feeling very dizzy, spinning for 8 hours, 12 hours, days at a
Wow.
time, weeks at a time. I may always feel some component of spinning.
Yeah.
They tend to be very sensitive to other stimuli. So, bright lights, loud sounds, similar to
Okay.
regular migraine, visually intolerant. So,
Mhm.
scrolling on my phone makes me nauseous and sick. Going to
Mm.
the grocery store where there's just so much visual stimuli, it's overwhelming. I don't feel good. I got to get out of here.
Okay.
Another one of my partners always used as an example was like coming down an escalator, and it just
Oh,
all of that
oh, that's not
stimuli
the
coming at
same.
you visually can
Yeah.
make you feel nauseous and sick.
And
So if
any of
people
that
are
that
have
happens during PMS is bound to get worse during perimenopause, right? Like
right,
that's the really bad news that perimenopause can last about 10 years
right.
and that can get way worse during that time, even if with menopause it goes away.
Yeah,
So I'm sure you see a lot of women in perimenopause.
I do. It's interesting too. There is a little overlap too between Meniere's disease and some
Oh,
of the migraine type of symptoms. So
okay.
migraines can give you ear symptoms like pain in
Hmm.
your ear, fullness, a clogged sensation,
Yeah.
ringing in the ears, but they should never change your hearing.
Okay.
So, many people will see neurology and they'll come and see me just to make sure it's not Meniere's when
Yeah.
what they described doesn't sound like Meniere's. But if there's any ear symptom with it, they're going to come to me. And you should come get your hearing tested if you
Yeah.
have ear symptoms. But definitely, you can have that kind of fullness ringing that affects one side, maybe both. But the thing with Meniere's is you should have a low pitched hearing loss on your test.
Okay.
And it can be a little tricky because in the early phases, the hearing drops during a Meniere's attack and
Hmm.
then goes back to normal. So you come see me, your hearing test is normal,
Yeah.
but you describe these things happening. So true classic Meniere's patient will describe feeling fine, and then all of a sudden that bad ear is full, clogged, ringing. Their hearing drops. I can't hear out of that ear anymore.
Wow.
And
Wow.
then I spin for 20 minutes to a few hours.
Wow. My goodness.
Yeah.
Wow. So I wonder for those who are having, if it's truly hormone related vertigo or the migraines, like you mentioned, I wonder if they would do better with hormone therapy. I'm curious because I was
Yeah.
telling you in the park that when I was pregnant, I had vertigo for the first time in my life. And
Hmm.
I assume because it's the hormone fluctuations that happened in pregnancy. And it's very debilitating. Like
Yes.
I could not drive. And I
Yeah,
was like, what the hell is happening right now to me?
exactly. Yeah.
And thank God for the ENTs who did the maneuvers on me, which I was telling Lindsay, it's like voodoo. Like they do, like throw you back, turn your head to the side, watch your eyes
Yeah.
start to spin. And then all of a sudden they fixed, you're fixed. And so it's amazing sort of what can happen. I'm assuming because of hormone fluctuations. And I just wonder if anybody who's having perimenopausal effects that affect their ear, nose, and throat, that if they're eligible for hormones, I wonder if helping them have like more of a stable hormonal, I guess, landscape during that
Yeah.
time
Yeah.
would help
Yeah.
because I am assuming that a lot, and at least for premenstrual migraines, I'm assuming they're because of the huge drop in hormones
Yeah.
that happens during
Hmm.
that time.
Hmm.
So
Yeah.
for my patients who have premenstrual symptoms, we either have them on birth control pills or estrogen, depending on their goals and contraceptive needs. So I'm so curious. Maybe we should do some research.
We could keep a list of them and see.
Exactly.
Yeah.
Have you been trying to figure out how to take your health into your own hands while you're waiting for a healthcare professional to see you for perimenopause or menopause? Or do you feel like you're just too young for perimenopausal treatments or too old maybe for hormone therapy? Or you just want to kind of dabble in something that's a supplement? Check out MIM at heymim.com. This is a supplement that we've created. Each ingredient has research to back up its use. We've picked them selectively to help you get through brain fog, night sweats, hot flashes, mood changes, and help you start to feel better. Don't delay another minute. Check out MIM at heymim.com or on Amazon.
Another thing, an interesting thing with Meniere's disease is, many women that have that, that's a fluid retention issue inside the inner ear.
Okay.
So very salt sensitive. And that's kind of a test too. Like, if my patients, if there's some overlap between migraine and Meniere's, like, well, if you eat a bunch of salt, does anything happen to you?
Right.
Because
Interesting.
that's really the key with Meniere's is salt. If I have a patient that I think has migraine, or there have been a number of women over the years that have had kind of an overlap. So I say, I don't know if you have Meniere's or migraine, and I can't test you in any way and say, oh, you're positive for this and not that. So I will give them dietary modifications. And with
Oh, interesting.
Meniere's, it's all salt, water
Yeah.
balance. Migraines, we have a diet sheet that we give our patients. And I'm always amazed at how many patients have a long history of migraine and may see a neurologist, but have never really talked about the dietary stuff. So there's a lot of foods, even healthy foods. It's not just red wine and chocolate, anything fermented. People drink a lot of kombucha these days. Avocados, onions are on our list. So
Oh,
not just bad things. I had a patient once who is vegan and she's like, there's no way, like my diet is super healthy. And I'm like, well, look at these aren't all bad things. And she was kind of like, oh, yeah, I need to eliminate some of these things.
that's so
Um,
interesting. Okay.
yeah. So many of the foods that trigger migraines happen to have a lot of sodium. So, it's a chicken or egg kind of situation. And
Right.
they come back in and they follow the diet and they come back and they're like, I lost 20 pounds and I feel great. And I don't know which one it was, but
Huh.
following the diet makes them feel better.
That's fascinating.
Hmm.
And that's the other thing I kind of wanted to bring up is that if you are having an issue, it would be so worth it to see someone like you in
Yeah,
ENT. Like I was telling you about someone that I knew who was having vertigo frequently and just was taking meclizine, which helps the symptoms but doesn't get to the underlying cause, taking it every day just in case the vertigo spell would happen. I was like,
right.
why would you do that? Get yourself evaluated and get the underlying cause
Yes, figuring out the
treated.
cause. That's number one. And
Yeah.
taking that good history
Yeah.
is how you get there. And then there's other testing that we do. Obviously, when you come see me, you get a hearing test to make sure.
Yeah.
Lots of people are like, my hearing's fine. I don't need a test, but they can have changes that are very subtle that they may not even notice. You have
Yeah.
to kind of cross a threshold to really be bothered by hearing loss. So
Yeah.
sometimes that pattern is there and they had no idea.
Hmm.
Again, if I'm more concerned for migraine, it's important to show like your hearing is totally normal. And another thing that can kind of throw a red herring into it is TMJ dysfunction. People that
Oh.
have jaw joint issues often have ear symptoms like pain, fullness, ringing. So somebody may classically present like a migraine patient, but they're
Mm-hmm.
like, oh, my ear is full and it rings.
Mm-hmm.
Again, without an exam and a hearing test, I can't tell you if you have hearing loss or not,
Right.
but oftentimes those symptoms are coming from the jaw, totally separate from any dizziness.
Wow, that's so interesting. Okay, I have a random one to throw at you. I always hear people talk about itchy ears, and they're like, "Oh,
Oh,
my ears become really itchy during perimenopause." Have you seen that?
yes,
What the hell? What is that about?
it's dry skin.
Ah,
So
see,
a
menopause is
conversation,
all about dryness,
yeah,
whole body,
yeah.
decrease of fluid. Yeah.
Yes. So as I counsel patients, even men, they're like, I never had an earwax problem. Why do I have an earwax problem now? It's because as we age, our
Yeah.
skin is drier. But again,
Yeah.
especially in that perimenopause phase, there's a big change. Dry skin makes dry wax. Dry wax can get stuck, or the dryness itself makes our ears itchy. So
Wow.
I have patients just put some oil in there.
Okay.
Any kind of oil, as long as your eardrums are intact,
Mm-hmm.
baby oil, olive oil, sweet
Mm-hmm.
oil, any kind of oil, just a couple of, I tell patients it's easy to remember. You have two
Yeah.
ears, 2 drops, 2 times a month.
That's awesome. Two, two, two.
Yeah.
Just like a cotton swab or something, just something
Just a,
gentle.
like a little medicine dropper if you
Oh, a
have it.
dropper. Oh, okay.
Hmm.
Okay. That is so interesting.
Yeah.
I know. I think this is the thing. We have been working in silos for too long
Yeah.
where every division and department of in medicine is separate from one another. And
Hmm.
menopause spans all of them.
All of it. Yes.
And we're finally starting to connect the dots. Thank you for sharing your expertise. Thank you for raising awareness about this. And
Absolutely.
I so appreciate your time. And if you have more questions, I will put some resources up for our listeners on looking at ear, nose, and throat, looking at vertigo, looking at migraines, and trying to do some self-assessments to see
Yeah,
if those changes are happening for the first time in perimenopause or worsened in perimenopause or menopause. Reach out, don't suffer through it.
right.
So there's caring people like Lindsay out there ready to help you. So thanks so much for your time.
You're welcome. This was fun.